Those services might be in the voluntary sector, they might be via university, college, they might be via employment services, and they could be via Health in Mind, or where available, places like IROC or the equivalent, so the youth services that are increasingly springing up around Sussex to support young people with lower level of need. There are different services in different areas, and one of our aims actually with developing our youth service is that we somehow manage to have one front door for young people in each area, and then who sits behind that front door, it can be different depending on which area you're in. So for instance, in West Sussex there's Mind, in Brighton there's YMCA, in East Sussex there's IROC, and there are various other voluntary sector organisations, Southdown Housing, that support people over the age of 18 with their mental health and with their other social care needs. There's also local authority, so if you're a care leaver, there's support for you up until the age of 25 if needed. And then there are also the drug and alcohol services available as well, who will integrate with other health services. There's Health in Mind, there's IAPT, these other talking therapies that you can access outside of the specialist mental health service, and GPs will have access to those, and a lot of them actually you can self-refer to as well. So one of the best things people should do is go online, find out what's available in your area, contact them if you feel it would be appropriate, and then arrange to meet up and see if they might be right for you. And your GP also should know what's available in your area. The one, I think, caveat to that would be that things do change, so make sure you've got an up-to-date list of what's around and what kind of services you've got to support you. Adult services available are based around community teams who form the backbone of the adult services, and then we have specialist teams like early intervention in psychosis, like assertive outreach teams, like the eating disorder team, neurodevelopmental service, learning disability service. So those are all add-ons to the basic community mental health team, who see most mental health conditions and manage a lot of people who have more severe and complex mental health conditions. The movement nowadays is, where possible, for people to return to the GP once they've had an episode of care with a team, because if you think about other clinics, if you were under a cardiology clinic perhaps, once you have your heart condition properly treated and managed, you're transferred back to the GP. So in many ways mental health services arguably shouldn't be any different. So people will have episodes of care. So once you move into adult services, you're not with them for life. Now what that means is that there needs to be really good communication across the system, so that if people are transferred back to their GP, they can be re-referred, admitted to adult services if they need to. And if you've left CAMHS and you're out being managed either by your GP or in contact with one of these other services, should things change, this is beyond your 18th birthday, and if you do need referral back into the service, the adult service, that's best managed by your GP, but you can also access services via A&E if it's really urgent. People who don't get referred to adult services can still get support, and there's a big piece of work that's been going on across the Trust and indeed across the whole country actually, called the Community Transformation Programme. The main drive of the Community Transformation Programme is to make sure that people get the right level of help for the level of need. And what this means is that if the level of need and complexity is not so great that you need a specialist service like an adult mental health service, then you'll be what should be identified for you is somewhere else in the community who can meet that need, who are not a specialist team. Generally speaking, the GP is your best person to be able to help you navigate through this and find if it hasn't been identified for you when you were transferred out of CAMHS back to primary care. But there are also various online resources as well that can help, and a lot of the supports that you'll find in the community vary region by region or area by area. So it's important that you look at your local area and see what supports are available, whether that's YMCA, whether that's Mind, or South Down, or some of the other voluntary sector kind of supports that are there. And also, in some areas there are youth services as well emerging. In East Sussex, these are called IROC. They have different names across the county, and at the moment we're just undergoing a big piece of work to try and join these all together into one youth service that really makes it easy for young people to navigate and access.